Communication is an essential part of everyday life. In the field of communication studies, one of our core theoretical principles says that one cannot not communicate. We use a variety of verbal and nonverbal communication to construct the world around us. And even when we're silent, we're still saying something. Hi, my name is Marianne LaGreco, and I'm an associate professor in communication studies at the University of North Carolina at Greensboro. And I'd like to take a few minutes to share some thoughts with you about communication and its importance to the study and practice of health. Before I get too far ahead of myself, it's important to understand what we mean when we say health communication. First of all, health communication is the study of a context. That means we use various different health communication theories to study different health settings, problems, and issues in order to solve problems, change behaviors, and meet the needs of communities. Now, you might be thinking to yourself, you mean we don't have any theories? But that's one of the things that makes health communication unique in my field, is that we use general theories to study these different health contexts. So to give you a more specific definition of health communication, the field focuses on how we seek, process, share, and construct health information. So when it comes down to it, it's all about relationships between people, texts, and technology. We might use interpersonal communication theories to help improve relationships between nurses, doctors, patients, and their families. We might use media communication theories to understand the effects of a health communication campaign that encourages people to stop smoking or exercise more. We might also use organizational communication theories that help us understand the complex networks that make up a food system, for example. So really, health communication is a very dynamic field, and I hope you can glean some of the important characteristics in what I'm about to share with you. In this whirlwind tour through health communication, I'd like to focus on three key areas. I'd first like to focus on public communication about health, which is probably what you're most familiar with. Then I'd like to share some key points about communication that can help you understand the health contexts we study. And finally, I'll wrap things up by connecting food to health communication and sharing a little bit more about the work that I do. Some of the best lessons that we can get from communication come to us from the specialty area of public communication. Now, when I say public communication about health, I'm really talking about public speaking and public discourse. So at the sheer mention of public speaking, I know some of you might cringe a little bit. It is, after all, a big fear for a lot of people. But one thing I can tell you for sure, public speaking is a practice. It's something you can get better at over time. I know many of you have had a chance to see my 2014 and 2015 talks for TEDx Greensboro. And what you're seeing there is a very polished and trained speaker who has worked for more than 2 decades to refine that craft. I've given some really bad speeches in my life, but I've learned from those and I've grown from them. And I've been able to become a better speaker as a result of it. So if I can give you 2 quick tips about public speaking, they are these. Focus on structure and style. So when you're focusing on structure, you're focusing on getting all of your ideas detailed out in a way that will help you advance your idea. It will help you distill your message. It will help you focus on your point. It will help you tell a story that's meaningful to people. The second part of that is to focus on style. Have some fun with your speeches when it's appropriate. Focus on building a connection with your audience and trying to be as conversational as possible. So those are my 2 big public speaking tips. Public communication about health also focuses on public discourse. And that's what we think of when we're talking about health campaigns, when we're talking about public policies or public commentaries about health policies that are being passed. There are a lot of things that happen when it comes to health communication in the public sphere. And so we need to focus not just on the public speeches, but also on the various texts and talk that make up health communication. I'm really glad you're reading Dan and Chip Heath's book, Made to Stick, because I think it's a great example of some tips that can help you become a better public communicator about health. Their focus on stories that are simple, unexpected, concrete, credible, and emotional really brings together 2 key ideas. that you need to focus on distilling your message and connecting with your audience. Sometimes you might have a new health product or technology that you're trying to launch. You have a health campaign that you are trying to make sure is effective. Or you might even have something as simple as an op-ed that you want to write for your local paper. And this advice that Dan and Chip give through their success model really helps you think about the core of your message. By making it simple and concrete, you're able to distill down to the key points that are most important and get rid of everything else that you can talk about later. By also focusing on stories and the idea to make your work a little unexpected but credible, and to access people's emotions, helps you connect with your audience as well. These are really two key ideas that reflect back to that idea of structure and style. When you're distilling your message, you're coming up with the best structure possible. And when you're connecting with your audience, you're really figuring out how to tell those stories and be conversational. In the summer of 2015, I had the unique opportunity to attend the Alan Alda Center for Communicating Science. And they use a lot of the strategies that Dan and Chip Heath talk about in Made to Stick as part of their core curriculum, particularly the idea of telling stories and distilling your message. It's a really unique program, and I would encourage you to check it out if you're interested, because a lot of the ideas that they talk about at the Alda Center can be easily applied to health innovation as well. Technology is changing at a breakneck speed, and we need to be able to keep up with that kind of public communication so that the larger public understands why health is important and how these innovations can really help us in the long run. In addition to public communication about health, I'd also like to offer you some thoughts on the key points about communication that make it really useful for the study of health contexts. So let's start by thinking about relationships and communication that happens between patients and providers and their families. We may use theories like uncertainty reduction to help close the space between patients and providers so that patients feel more comfortable disclosing information to their doctors and nurses, and doctors and nurses know the right kinds of questions to ask to get the best information possible. We might also use different theories of social support to help build a stronger relationship between the patient and provider. In doing so, it allows for trust to develop between the doctor and nurse and their patient, and vice versa. Another key area that we have often focused on in health communication is the idea of health literacy. Now, health literacy is not unique to the field of communication studies. You also see it in public health, you see it in nursing, you see it in various different medical practices. And it's the idea that when it comes to health, we're dealing with a lot of complicated information. And we need to make sure that the people who are receiving health information have both the capacity and the understanding to apply that information in their own lives. And so health literacy really focuses on different strategies to develop the best information and the best messaging possible. As such, it becomes a core communication issue for us to focus on. So taken together, both this interpersonal focus and this literacy focus laid the foundation for much of what we think about when it comes to health communication. And both of these are still important as we think about innovation because of these bottom three pictures that I would like to share with you. First, technology is changing the way that we think about health communication in significant ways. The iPhone is not that new in the grand scheme of public communication about health and interpersonal and health literacy issues. And we have to be able to respond to these changes in technology and the way that it's influencing how we manage health information and how we communicate about health generally. We also need to focus on organizational communication theories that help us think about the entire health institution and the communities around it. We need to be able to think more critically about our hospitals and the way that they're networked to various different health practices like farmers markets and walking trails and physical activity. And finally, there's also an area of community engagement that is emerging in health communication that encourages us to focus on incorporating multiple different perspectives into problem solving around health. I share these with you just to give you a little bit more insight into what we focus on when it comes to health communication. That about wraps up my quick intro to health communication and why it's important to innovation and the study and practice of health in general. But I'd like to leave you with a few thoughts on how communication has been important to my work with food. Again, as I've mentioned, most of you have probably seen my TED Talks from 2014 and 2015. Those talks really allowed me to access a public in ways that I hadn't before. We had some really serious questions about food insecurity and food hardship going on in Greensboro, Guilford County, and the Piedmont Triad. And by engaging the public through these spaces, I was able to help people understand the scope of the problem and, even more importantly, what kind of data we should be paying attention to and what kind of programming we should be striving for. So we've been able to design farmers markets, shared use kitchens, mobile farmers markets, community gardens and urban farms, and a very strong network when it comes to health communication around food. In addition, I've also done things like written op-eds for our newspaper to help people understand what some of these food hardship ratings and the language of food insecurity really means, so that people can get a better grasp of what they're dealing with in their own households, as well as their communities in general. So communication has really played a key part in helping me to facilitate and mobilize conversations around food. I've drawn from community engagement theories, organizational communication theories, technology, even a little bit of social support and socialization theories, all to understand how we can get food to people and how we can get people to food. I hope you've enjoyed this little brief tour through communication studies and its relevance to health, and I hope you have a great study of health communication this week.